All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408-687-1899, and my email address is homeomedicine at yahoo.com. If ever, in case you are suffering from any disease at any age and stuck up with the treatment, do not have any progress, you can call me for the second opinion of your disease as well as of the prognosis of your disease and how it is progressing and why the improvement has stopped. So I can guide you according to the natural principles that what are the hurdles uh, for your cure and how you can remove those things so that your this disease or your improvement can progress furthermore and you will get well soon in this way, uh, because there are some certain norms, principles. In any case, if you are not following the principles, ultimately, hit and trial methods are not always successful. Yes, they are. Temporarily, we see that by hit and trial methods, sometimes you get something which was not in your mind, even, and that has happened in your life, in your disease, in your other circumstances. And and you said, "Oh, this is what happened. I was not amazing that one." But even then, that has happened, even then that has been happened, so no problem. uh, I am telling you, whatever we can do according to the principles. Principle means a shortest way to explain a route from health to sickness, from sickness to health, and how to achieve that one. Whatever has been done in the past by medical science, and what hurdles they faced during this journey, and how they were eradicated, how those hurdles were removed from the health, and ultimately you get well. If you're surviving, it means you have passed the hurdles, you have crossed over the hurdles. And this is what everything is not without any principle, by any scientific set rules. In the beginning, sometimes we do not know about the scientific rules for anything, but ultimately, with the experience, with the experiments, we learn those things. And I'm here to discuss all those experiences which the medical science has faced, resulted, and learned ultimately that that these are the this is the shortcut way, just like between 2 points there is the minimum line that is known as vertical lines. That is the only vertical lines, and that can be the shortest way to reach from one point to the other points. In this way, in homeopathic system of medicine, or in any you forget that about this one, in any way, when health is deteriorated and going back, there are two points. One is health, then it has gone to the sickness, how it has gone to the sickness, what way it has passed, what were the hurdles in this way, and ultimately it has reached to the conclusion what we see at this time, the condition of the disease. And now, when you go back, it is not necessary that you will go back with the same route. No, you will try to find out those the shortest way without hurdles to reach to the health, from sickness to health. These are two points. And in this way, And there are certain rules set by the nature, and we have studied those. And there are different kinds of hurdles, obstacles to reach to that certain points. And I can guide you about those certain hurdles that which may face, and there may be a delay in your cure. And most of the things are related with your day-to-day life, your food, your sleeping headache habits, and overall running your life. So many of the things I was discussing yesterday, that many of the things are coming in a routine, and you come to know that. And many of the things you are using them, you are applying on your life regularly, and do not think that these may be the hurdles of my cure if I become sick. So all those things are considered as maintaining causes. The first thing I yesterday told you about, that one, the exciting factors with which a person can fall sick immediately, and you just know that it is all because of this. Just I told you that you can survey about 72 hours, and you surveyed about 72 hours, and you see, oh, I took hard, I took pickles, I took curds and this and that, whatever has happened within 72 hours, you will blame that only. But ultimately, if these things or these hurdles are repeated in your life to make you sick, ultimately there are some other reasons behind that, and that you have to go to find out those reasons, and find it out your own capacity, that how far you are capable of removing all these hurdles. And those are causes known as fundamental causes. First thing, exciting causes, which anything you have eaten, anything you have done, has excited the condition of the disease, make you sick. And after that, we discussed that there are certain things you are doing regularly, maintaining in your life regularly, but you do not believe that these things can cause any problem and can make me sick if I continue all these things. You do not believe that one, because you are using these things since long, since many years you are doing the same thing, and you did not fall sick. But now you fall sick, and ultimately, after removing all the exciting factors which you think are immediately responsible for making you sick, that has been removed now. But even then, you are falling sick. Even without those exciting factors, without those substances which were making you sick, and you have avoided all those substances, even then you are falling sick. Then again, you have to find out, you have to do the survey, and that survey I already correlate it with cleaning of the rooms, that if there be any type of smell coming from the rooms, and then you want to get rid of this bad smell from the rooms, you will take off all the stuffs inside the room out, and ultimately you will clean the room, and then you will come up one by one. You will put all these stuffs, all your books, all your utensils, all your everything, one by one into the rooms, and ultimately you will come to know that after taking this thing, which I I want to say that immediately, totally, if you are not recovering, or even after removing the exciting factor, you are getting sick, and it's making the long-term sickness, that is known as pseudo chronic disease. Basically, these are not chronic diseases, but these are known as pseudo chronic diseases, artificially made chronic diseases. And under those conditions, I have given you the explanation of the medical philosophy. What has medical philosophy learned from the knowledge of experience, that you have removed all these stuffs from the rooms, and ultimately you are bringing those things back to the room one by one, and ultimately you will come to know that which thing was having bad smell, and then you can remove that forever, and then you may get well for permanently forever. So in this way, many of the things which you are using continuously, regularly, you do not believe that this can make you sick because you are using it regularly. Here, the doctor mostly under these conditions, when the conditions are not recovering, or even when after all the precautions doctor told you, even then you are getting sick and you are lingering in your disease. So then the doctors will advise you totally to shift your diet, totally to shift your living standards, totally to shift your environment as far as possible. Just like the tuberculosis patients, doctors say, okay, go to the hill station, that you will get a fresh oxygen, fresh air over there, fresh air. And the same way for many of the things, those who are living in close to the sea, uh, they are having mostly the joint pains and all that, because the heavy metals are evaporating with the uh, water, uh, and ultimately you have to breathe in that air which has a heavy metals, and they were evaporating from the sea water, and ultimately you are breathing with that one, and they are making concentration inside your blood, and they are making a deposition somewhere, and you feel pain in the muscles, pain in the joints, and all that one. So this is one example I'm giving you. So under those conditions, wherever you are, it's not necessary that you are living in near the sea bank. No, it's not. Wherever you are living, there may be such type of conditions that they are producing a particular type of changes inside your life, means they are making you sick. So under those conditions, you have to follow those conditions with the direction of the doctor, that yes, you have to change that. Whatever is your routine food, though you are taking since birth, whatever your routine food is, and now, it was okay before this one, but now, since 1 year, 2 years, you are, this food is making you sick, and you are sick for a longer period. And ultimately, you cannot believe that the same food, same wheat, or same everything is making you sick. There are other reasons that this wheat flour or everything may not be original, may not be pure. That has been adulterated with the pesticides, fertilized, whatever. That is why at this time it's making you sick, because you are taking since long this wheat concentrated with all these pesticides, and ultimately their concentration in your blood has increased, and they have raised your level of sickness up to 100. Just like I give you the example of boiling water, that it boils at 100 degrees centigrades, and if it's 99, you will not feel that I'm sick. But ultimately anything happens and it goes to 100 and you feel sick. in this way in this way, whatever you are eating regularly, and just going on, life is going on, and ultimately you take something and it make you sick, and yes, you know that I took this thing and it made me sick, you can avoid that. But I'm talking about the other second step of this one, that if after taking out your all exciting factors, and now you are in a routine original things what you are doing since long, since many years, but now you are falling sick. Under those conditions, you do not know what makes you sick. Then the doctor will suggest you to change, reshuffle everything, living standard, eating habits, and everything. You have to change that one. Just like you are removing all the stuff from your room, because you do not know which is making sick, which is smelling bad. And then ultimately you add the same thing one by one, one by one. Then ultimately you will find it out, after taking this thing, I'm feeling sickness, I am having this changed standard of health, feeling uneasiness. All those things will indicate you that, oh, this week I started this wheat, this week I started this curd, this week I started this and that. whatever the things you are taking. So ultimately, you will come to know that one. But you will be astonished at this time. Oh, this thing I'm using since 10 years, since 20 years, since I birth. Since my birth, if I'm using that thing, why it's making me sick now? Maybe that substance is not pure. Maybe the concentration inside your blood is not accepting this thing under these conditions. That is why you are falling sick. So, simple thing. Simple thing that you have to avoid those things and you have to choose alternative of those. You need food, you need every day, but nowadays we are very much learned about this thing. We know our body needs protein, how much protein we need. We body need fat, how much fat we need for the daily requirements. Protein, fat, carbohydrates, all these things, vitamins, minerals, whatever. We have daily requirements for the bodies. And then you can fulfill this requirement from the already continued food. You are taking whatever food type you are taking, it's making you sick. And now this is the time that you have to change that one to another level, that how much fat you need daily, how much curd you need daily, how much protein you need daily, how many eggs you will take daily, whatever, all these things you will change. Components of our food will change. The source, protein will remain protein, fat will remain fat, carbohydrate will remain carbohydrate, mineral will remain minerals. But we have to change the source. What it indicates? It indicates that this previous source, which was already continued since many years, has concentrated inside your blood, which is making you sick continuously. And now it's a requirement of the body that you need protein, that you need fat, that you need carbohydrates, minerals, and vitamins. And then you have selected, because this source of food is making you sick, then why not change this, the trend of food materials, what you are taking, and take another alternative style. In this way, about the environment, you can say that I'm living, I born here, I'm living here since many 30, 40 years, and now this environment is making me sick. How it is possible? I am working this office since like 20 years, and everything is maintained of that one. But even then, ultimately, you are falling sick, and this sickness is continued. This sickness is continued. It looks like, yeah, I'm having a chronic disease. Everyone can imagine, if anything, altered health continued for a longer period and is not improving with any of your medications, everybody can assume that I am having a chronic disease. But you know the definition of the chronic disease? Chronic disease starts gradually, continue, live with the life, and ultimately take the life with it. Means the person die with that one. That's the definition of the chronic disease. Progress gradually, 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 ultimately, this system is unable to bear the condition and done. Acute disease, I told you, immediately these are come like a storm, pass their few time limited periods, and ultimately they go off. But still, after exciting factors, after this type of things, acute conditions, there are big damages may occur inside your system. Just like a storm comes, earthquake comes. Earthquake is only for a few minutes, seconds. But with that earthquake, many damages, walls, houses, electric poles, trees, and everything, they have fallen out. It will take time to recover that one. So, under acute conditions, you need to give time for the repair of the damages after that. Disease or the reasons for making you sick has come and gone, like a storm. That is known as acute diseases. But for the chronic diseases, you suffer for a continued period, a long period, and ultimately, time to time, it is progressing, and at the condition, at the end of the life, ultimately, you will go with that one. Anybody can die with the chronic conditions, but I'm saying here a different thing that is known as pseudo chronic disease. It looks like a chronic. Gradually, it is making me sick. It means it is the definition of the chronic disease. Gradually, it is making me sick, more and more sick, more and more sick. It looks like that it's chronic disease. But when you survey your lifestyle, your food habits, or your environment, and everything, and you shuffle all these things to a different type of standard. Just like I told you about the food materials, that you are taking wheat, you are taking vegetables, this and that, and still you are suffering from the sickness, having some problems, and all that. These are the source of fat, these are the source of vitamins, these are the source of many other things. But ultimately, doctor suggests you that your disease looks like a chronic, but let's experiment it, whether it is chronic or pseudo chronic disease. And the pseudo chronic disease is when you remove or when you change all the alternatives of food, when you change the environment, when you change your lifestyle. Just like a person is having night duty, since long they are having night duty, and I have explained you many a times that in the midnight, wherever you are, whether you are in India, whether you are in America, wherever, in the midnight, a exchange takes place inside your body, and that exchange is not possible if you are awake at that time. It means you will not refresh your body, refresh your lungs, refresh your cells with the oxygen. That is not possible because your body muscles are rigid, you are working, you are awake. But when you are asleep in the midnight, you are relaxed totally, then that process can fulfilled, and then ultimately you will be healthy, or you can say the active in the daytimes. So this is what, and one example I'm giving you. So ultimately, if you change all the patterns of food materials, no doubt you are taking the same minerals, same vitamins, the same everything, but you have changed the source of food, and you have changed your duties, working orders. You have changed that. You have changed the environment when you are living in one environment, though you are living since birth, because it is making you sick. And now you have changed that one. So ultimately, you will find it out that if you remove your eating habit, you have changed the source of food. If you remove the environment where you are living over there, all that, if you change your living standard, living habits, you feel okay. And there are no chances to be diagnosed as a chronic disease. There is no any pathological change inside your tissues. Everything was functional. And it was all because of the changes or the concentration of toxic substances in your food, in your behavior, and everything. And then gradually you will start feeling better, and gradually your health will improve. So those diseases which looks like chronic diseases means progressing gradually, and progressing gradually will stop if you change the three things: food source, environmental change, lifestyle changed, and in a short period you will start feeling better. Yeah, I'm a little better than this one. My condition is better, my joints are better, my other things which are I was feeling sick, and now I'm feeling better. What does it indicate? It indicates whatever the condition was not actually the chronic disease. It was a pseudo chronic disease. It was looking like chronic disease, but it is not actually a chronic disease, because I give you the examples, definition of the chronic disease, that they come gradually, pass their course continuously, go on increasing continuously, and ultimately end with the life. But now, after removing all these patterns, lifestyles, and foods, you started feeling better, which is not possible in chronic cases. Just like in case of cancer, just in case of lupus, just like there are many more chronic diseases, autoimmune diseases. There are many more autoimmune diseases where even if you change all these things, you do not feel better. Those are the things, and some of the things which are genetically intervening in your life. Your father was having, your grandfathers were having, or somebody in your grandparents they were having, or parents are having, and that has been transmitted to you by the genes. That's difficult to be cured. That's only possible to be maintained. But I'm talking about those things which are actually not chronic diseases. These are known as pseudo chronic diseases. If you change the behavior, if you change the lifestyle, if you change the food source, you start improving. You feel healthy. So this is mostly comes under the section of maintaining causes. So two causes are covered. One, the exciting factor, which immediately make you sick. One, the maintaining causes, which was maintaining regularly your disease. And ultimately, the body was becoming weak and sick, and ultimately it is progressing, and you think that it's a chronic disease, which is not. And if you change all these patterns of your life, then you start feeling better. And some time will come when you will get well, because every tissue which has impairment inside your body, all the systems, all the cells, all the tissues, they have their own repair time, they have their own capacity to recover himself if suitable environment comes, if suitable diet and everything has been supplied. Ultimately they start recovering. And I'm saying that every tissue of the body has a specific period time that it will recover fully. Just like many times I given the examples of these things, that if the epithelial, the lining inside the mouths are damaged, the normal period for recovery is to 3 to 7 days. If bone tissues are damaged, bone is broken accidentally or whatever it is, we know that it is for 6 weeks. Why we say 6 weeks plaster? Because we know that the repair of the bone tissue will take this much time. So I'm saying that all the four types of tissue which the body is built up of, it has a specific time period of recovery. And if you facilitate them by removing the disease producing agents, food, environment, and everything what we have discussed now, if you have changed all things, mean you are facilitating the health to come back, and it will come back. The second thing I'm saying, it will take time. It's not immediately. And if we are knowledgeable, sufficiently knowledgeable, that what type of tissues were producing the disease symptoms, and then what time they will take to repair, if they are let go to repair, if they are not having any hurdles in their way, then how long it will take to repair. Sometimes even there is an accident and the bone is broken, and doctor says, okay, we will take 6 weeks plaster, means it will take repair for 6 weeks. And ultimately after 6 weeks, doctor, oh, no, 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 your joint is not perfectly well, no, you need more plaster. And they try to find it out, what are the reasons behind that, why this joint was not perfectly cured, repaired. There are certain other causes. The same way, I'm telling you, every tissue has its repair time. How long it will take to repair if all the contraindicated sources are removed, if all the contraindications are removed, the hurdles are removed, then how long a cell will repair? This tissue will repair because cells are making the tissues and tissues are making the organs. And the organ, if one organ is damaged, we know that what type of tissues are involved over there, and then you can figure it out. If all these things which are making you sick has been removed or changed in their pattern, or you have make some alternative, the pure alternative, which is not addicted, which is not having any toxicity which can damage your body, then it will start repairing, and it will take a specific time when it is repaired. So ultimately, this is known as pseudo chronic disease, not actually chronic disease, but they were looking like a chronic disease. And under those conditions, I'm advocating is this thing, with the reference of the medical philosophy, that you have to survey your body, and you have to survey your environment, you have to survey your food materials, and you have to change it immediately. Immediately change will start immediate progress, repair of your tissue. And immediately, just like I gave yesterday one example of that, you have a bundle of notes and they are wrapped with the rubber, and ultimately that's too tight, rubber is too tight, no note could be fixed extra than this one, and ultimately you take off a few of the notes out of that one, rubber will be relaxed. So the day one, when you start taking out all those substances and change the food material, change the environmental side, change your lifestyle, immediately you will start feeling better and better and better. And this betterment will go complete until the under the tissue which are damaged are repaired fully. And if those tissues are repaired fully, you will not say that my disease was chronic disease. This is what many of the things, peoples are cheated, peoples are looted by this thing because they do not know about this thing. Everybody is, oh, you are having a chronic disease, this and that, but ultimately they are not having the chronic disease, they are having pseudo chronic diseases. But we do not survey of the things which are making him sick, and we do not advise that one, or in what or the other way they are not able to follow those things. Under some circumstances they are not able to. If a person is doing night job, and I told you the night job, night is just like the circadian system, I told you many a times. Our pineal body inside the brain, that is working with the nature, and that works according to the circadian system. Circadian system means natural light and natural darkness, and that is guided by those things. And if you avoid or if you do not obey the natural rule, ultimately your body will surrender. Ultimately your body will surrender to the sickness, and you will become sick, and this sickness will be continued until you find it out that you are not following the natural principle, purified systems, purified natural systems, you will continue being sick. And if you find it out and you follow those instructions of the circadian system, and this day one, you will start better feeling. You will start it that yes, you are on the right way and you are on the right track. Ultimately, this journey ultimately will end into health. Starting from the sickness, you will go to the health sides. And every system, every function of your body ultimately will recover that one. So these are two main important things I want to discuss with you. The third thing, The third thing or third type of causes of producing the disease are known as fundamental causes, just like foundation. From foundation, we have make the fundamental causes. Basic karan, basic reasons, which are beyond our limit. Just like I told you about the genetic type of diseases, inherited diseases, coming from generation to generation, and we are representing those things at present. We are unable to remove that one. But still, we have learned from the experience that we can manage them. We can maintain them. And we can maintain them how? I have given you many times examples in these programs that mother has made a spicy food. She has made it. Whatever the pepper, whatever the salt, whatever the other spices, she has added whatever her knowledge was. And ultimately, you try to eat that food, and you said, Mom, there is a more salt in that one. Can you please take it out? It's not possible. It is not possible that she can take it salt out of that one. Though there are many more chemical things than whatever the experiments, physical experiments and chemical experiments, and then that one, it's not that you can remove, separate the iron, sand, and salt from each other. No, it's not that simple. So ultimately, the body, when your genetic character was joined, a sperm and ovum, they joined with the 23 pairs of chromosomes of each side, and ultimately they were having only one pair of chromosomes, which was preserving the characteristics of your forefathers, your back generations. And ultimately, whatever any genetic type of disease they were inheriting, that has a stock in it, and you are made from those genes from mother and father, and they joined it. X or Y, I have explained many times all these things, but ultimately these things are your fundamental constituents. Your body is made up of with those things. Every of your cell, every cell of your body has the same component, same thing, cannot be changed. And under those circumstances, what are the inherited diseases you have to suffer? You will suffer syphilis and all other. There are many more things we have. When you go to the doctor asks you, oh, if there is a cancer thing like that, do you have any person in your family, mother, sister, father, son, whatever, who are having cancer? Same way we are asking about the heart attacks. Is there any family history that your parents or your forefathers, and they were having any heart attack type of things? Then why they add? They ask it because these things are packed up in your genes, and your genes are preserved in your nucleus, and the nucleus is the main component of each of your cell. It's not difficult. It's not easy that you can remove that tint from each and every cell. When mother was making that spicy food, at that time it was possible. And now, just like Dr. Hargman Khwana has started the genetic study to evaluate and to eradicate and to clean the genes, it is still going on, but it's not still possible that diabetic parents are not having diabetic children. They will be, but they are still trying to that one. But I'm talking about the stage which already has those tints of your forefathers in the shape of genetic character. And that is a genetic character that you have to abide by. But what you can do, if something is wrong, which is not acceptable, what you can do, you can try to adjust that one. And you will try to adjust that one with which? With food material, with living habits, with changing the environments and all that, which can make you easy life. So when there is a fundamental causes of your sickness, it means that these are the condition which are inherited, and you cannot run out of that. You cannot run out of that means you have to obey that one. And these are known as fundamental causes of the diseases, genetic genetic causes of the diseases. In this way, in this way, with a long analysis of the cases, when after all, because many of the patients say, doctor, whatever you told me to avoid in food, I did that. Whatever you give me the instruction that you have to use this kind of food, I am doing that one. And you told me to change the environment, and I shifted from cold areas to the hot or warm areas. I have changed my job from night job to day jobs. Whatever is possible, I have done that. Just like previously I explained you. When you do all these things, ultimately you will start improving. And ultimately you will reach to a conclusion of health. Day by day you will improve. But if you feel that no, you are not improving, even all the instructions done given by doctor, I am obeying all those things, I am doing all those things, but even then I'm not recovering from the disease. Even then my sickness is still there. Then the second step comes of this fundamental causes. So those fundamental causes normally are the genetic factors. And under those conditions, genetic factors, we have to find it out what type of maintaining and what type of exciting causes are exciting the disease, are maintaining the disease side by side. Now you know that. Now it is clearly that everything according to exciting factor, everything according to maintaining factor, I have ruled out, and I am taking care of myself based on all these things. I have changed behavior, I have changed food materials, I have changed lifestyle, and everything I have changed that. But even then, if you get well, it was the pseudochronic disease and it was because of the maintaining causes. And even if you are not well, even after doing all these things, then it will lead you to the fundamental causes. Chronic syphilis type of things, chronic tint of the this cancerous type of things, heart attack type of things, this stroke, and all these things are mostly, if these are repeated generation to generation, these are the things because some changes are in the genetic factor. They are ultimately at certain age. But sometimes what happens that a child is born, it was a normal, and because most of the things when you see the examination of the children's, you see cleft lip, cleft plate, you see there are many more other problems in the heart, you see many more anomalies inside the body, that the body was not complete when the child was born. But you can recover all those things Many of the things we are capable of repairing, the things which the God was having a deficiency to repair them within 28, 280 days when it was living in the mother's womb. It was supposed to be clear, but it is not because of the genetic factors. It has not been completed. And now we are capable of maintaining all those things by our medical science knowledge, surgery knowledge, and all those things. We apply all those things, means we maintained all these things. We try to maintain all these things, but still there are many more things which we are not, which the human beings are not capable of maintaining, and those things. And the disease condition, and disease condition after a certain age comes up. In the initial stage, sometimes it does not seem that there is any abnormality, any anomalies, but ultimately after a certain age, you feel heart attack, you have stroke type of things, you have many other things, the syphilitic type of eruptions on the skin and all that. It's not necessary that when you born you are having syphilitic tint and you are having syphilitic eruptions on your skin, but ultimately after a certain age you start doing this one. You are not snuffles when you born, but ultimately after an age, though it is maybe excited with the environment and all those things, but if there's none of this type of exciting factor or maintaining factor, even then after a certain age you snuffle, you speak in a nose, you feel snoring, you feel difficult breathing through the nose. All these things are also syphilitic tint, and this is also coming from your genetic character. And these genetic characters are important to be obeyed if you want to remain healthy. Otherwise, then you have to obey all these things and find it out that what are the causes maintaining, or what are the causes fundamentally. You have to avoid that one so that you can maintain your health at a certain level, not at a fully healthy level, not at a fully healthy level, but at a certain level you will feel better that, "Yeah, it's okay, yeah, I can run this life. Yes, I'm doing all these things normally and everything." But still, if we have to take the standard of health, you are not coping up with that one. You are still considered as a sick person because of some deficiencies which are not maintaining the medical standard of health in your life, in your body. But still you are okay to work in this life. So these are known as the fundamental causes. And under these fundamental causes, you must be aware. It's not that immediately at one point you can come to that conclusion that, oh, you are having a fundamental cause. No, it's not. It's a gradual progress. It's a gradual, it is resulted out after evaluating the person, after removing the exciting factor, after watching the patients, and ultimately, after all, when you will see that all the exciting and fundamental factors have been removed, and then then you feel better. But if you do not feel better, then it is a fundamental cause. And when ultimately you diagnosed it that it is not a acute disease, it's not a chronic disease, it's not a pseudo chronic disease, then what is this? This is a fundamental cause. And those fundamental causes you have to maintain. Always you have to maintain all these things. So this was today's chapter. Last my lectures were in the section of chest, and in chest area I described everything about the structures of the chest, how it was formed, how many ribs, how they are attached to each other, how they are attached to the backside. Then I explained what are the organs inside the chest, lungs, both, heart, mediastinum, and what are the contents of mediastinum. And when I was discussing the mediastinum, I explained everything, that what are the structures passing, going up and down in between the mediastinal area, and then described one by one about their abnormalities. If there is abnormality in the esophagus, what will be the signs and symptoms you will feel in the chest? If there is any abnormality in the heart, because heart is also a content of the mediastinum, and if it's a content of the mediastinum, it means if ever anything happens to the heart, it comes under the section of mediastinum in the chest. And in this way, all other, just like the main blood vessels, they are supplying the blood from heart to the whole body, from the head also to the whole body downward. And also the blood is coming from upward to downward, from head to downward back to the heart, and also from the foot to upward to the hearts. Or all everything has been explained within the limit of this pathway. This is basically known as the pathway between the chest, and that is known as the mediastinum. Few other things I have explained you in this area. That was I told you there is a cisterna chyli. When food goes to the intestines, it is squeezed, just like in the intestines, it is just crushed, squeezed, and the materials which is required for the body, minerals, vitamins, and everything, whatever it is in the food side, it is squeezed and is collected by the mesentery. This mesentery is a overlapping tent on the intestines, and it has channels, just like the our arteries and all that. You can say that they are having channels. They collect this squeezed material and deposit it into the backside of our back, alongside the vertebral column, that is known as sternochyli, and that is filled up gradually. This is filled up, and from bottom to upward, and ultimately when it is filled up completely, and at our left subclavian. This is clavicle bone, and underneath there is a vein. Always the vein, you know that when all the blood vessels which are bringing blood plus the garbage from the cell is known as venous structures. So it is dropped up into the subclavian vein. This is known as vein, subclavian vein. All the food material squeezed from our food, from the intestines, ultimately goes upward, and it is mixed up into the subclavian left side. The left side subclavian vein, and then goes to the blood. It is mixed up with the running blood already running into the systems, and ultimately it is used by different organs when it goes to the different organs. So all these things I have explained one by one about this mediastinum. And if ever anybody still needs to get some knowledge about the mediastinum, if anybody wants to get and need knowledge about the blood vessels in the chest areas, just like aneurysm, I have described about that one, just like the thyroid, and this hypo and hyperthyroidism, I have described about that one. In this way, if ever anybody have any question in the chest area concerning the lungs, concerning the diseases of the lungs, concerning the heart, concerning the structure of the heart or structure of the lungs, and also the functioning of the heart, and all this one, if anybody wants to get knowledge from all these things which I have already explained, but even then you want to, then you can call me at 408-687-1899 anytime. If you are suffering from any disease at any age and you are not getting well, just like I explained today, I can guide you What may be the reasons behind your sickness that you are not getting well? I can guide you properly according to the natural principle by which the nature was curing us when there was no medical science. The period of medical science is limited from 17 centuries. Before that, we were not having any principle or any scientific rules or knowledge about the medical science. And ultimately, we learn from experience that what the nature was doing to cure the patients, cure the sick persons, and ultimately we follow that one. And we follow that, then that is our guide. Basically, that is our guide. That's the principle how the nature was curing, and then ultimately we learn the hurdles time to time because the hurdles are changing. Hurdles, obstacles to get cure are changing time to time because the time to time food is changing, time to time environment is changing, time to time our living habits are changing. So causative factors are already changing time to time. Then we have to find it out time to time what are the causative factor behind any disease, and I can guide you to find all these things, that if you are sick, if you are not recovering from any disease, what may be the cause behind your disease and how you can remove that one so that you can get well soon. So, this was all about today's lecture. Tomorrow, we will enter into the abdomen area. And abdomen area, we will describe what are the structures of the abdomen and what are the organs inside the abdomen, where they are, what is their structure, what are their functions, and what are their important diseases which everybody knows about that one. So I will describe all those things. I will start this lecture tomorrow about the abdomen onward. I am your host Gurdeep Singh Sandhu, homeopathic consultant, and my clinic address is 9701 Sarah N Court, Dublin, California 94568. Phone number 408 687 1899. Anytime. If you are suffering from any disease and need my opinion, it's a free of cost. You can call me at 408 687 1899. And I'm requesting all the times. Yes, I'm thankful to all those radio stations, different radio stations, which are cooperating with me and to deliver this message to the public, conveying their listeners and all that one. So I request to all of you, if you think that these lectures are giving you some knowledge to make you healthy, to make you fit, then please convey this message to your nearest and dearest so that they can join me on my Facebook, Gurdeep Singh Sandhu, homeopathic consultant. They can join me on YouTube, my new YouTube channel, Homeopathic Natural Medicines, or they can listen Sabrang radio stations every day from 5 to 6 p.m. and daily. It's a daily program from 5 to 6 p.m. California Pacific Standard Time. You can join me and you can listen all those things. But if you are not available at that time, you can go to my YouTube channel, or you can go to even on Facebook. I think this Facebook, it remains for about one month. Those lectures remain on 1 month. But on YouTube, you can see me there. There are thousands of my lectures from head to heel for all the systems, for all the diseases, for everything. I have tried to explain these things in 3 languages: Angrezi, Hindi, Punjabi, so that every person who understands Hindi, Angrezi, or Punjabi can understand what I'm saying, what I want to convey you about your body, about your health, about your sickness. So you can learn about this thing, and please convey this message. Help me and help your relatives, friends, so that they can listen all these lectures and can get knowledge, understanding about this body and how it falls sick and how they can avoid the sickness. God bless you all. We'll see you tomorrow. We'll enter into the abdomen area. Thank you.